I'm Dr. Doug Bartles, an orthopedic surgeon and sports medicine physician with Mayo Clinic Health System, and I'm here to answer any questions you may have on sports-related injuries. Yeah, it's a really good question, and it's a big misconception about what we do. There are athletes of all ages, truthfully. So in my clinic, I see, teens, young people, all the way to, 80 or 90-year-old patients. And sports medicine is really all-encompassing. There are athletes of all, activity levels, from your high-level professional athletes to the more weekend warrior type. So it's not just for our high school or college age people. It's really for anybody. A very common thing that people see that they're having an appointment with a surgeon and automatically think that they need surgery. And when I say the majority of the time, the things that we treat are non-operative entities or pathologies. Not everything, even tears or sprains or strains, need surgery. We can do a lot of good with surgery, but we're also very selective because surgery is a big deal, and so we want to. I don't take it lightly, and it's all about having a conversation with the patient and what their goals are and what's right. Most of the time, it's not surgery. I think young people are becoming very involved in athletics at a young age these days, and it seems like the trend a lot of the time is for sports specialization now. Especially in areas where there might be warmer weather, or even in the upper Midwest where it's colder. It's more of the time. Athletes have started to kind of cling to one sport and play that year-round. And this has been looked at a lot, actually, in terms of the orthopedic and sports medicine literature. And kind of avoiding sports specialization can go a long way in terms of injury prevention. So not just playing baseball all year round or hockey all year round is really good in terms of helping prevent those common injuries. Some aches and pains are very common in a long season. If it's something that, if you twisted an ankle, sometimes if it's not a serious injury, yes, you can play through some pain. It's really challenging to, for coaches to be able to assess that on the sideline. Truly, if you've sustained an injury and the pain is pretty significant to the point where you can't get up and walk around, it's probably not a smart thing to try and play through the pain. We try and make it as easy as possible to get in and see us, and we can then provide you recommendations. Again, our goal is to get athletes back out there as quickly as we can. So it's not always smart to try and play through the pain. Probably makes more sense to just come in and see one of us. We can try and figure out what's going on and get you back out there as quickly as we can. To learn more, please click on one of the links on the screen or in the description below.